Good evening and a very warm welcome to the members of my medical fraternity. Probably we are winding up this winter season or session with a talk regarding challenges faced by diabetes in the 21st century. Welcome everybody. Diabetes is at crisis levels. We cannot afford to delay action any longer. The human misery and suffering caused by diabetes is unacceptable and unsustainable. Every year, over 4 million people die from diabetes, and tens of millions more suffer disabling and life-threatening complications such as heart attack, stroke, kidney failure, blindness, and amputation. Diabetes is also implicated in and has negative consequences for certain infectious diseases, other non-communicable diseases, and for mental health. Diabetes is not only a health crisis, it is a global societal catastrophe. Governments worldwide are struggling to meet the cost of diabetes care. Costs to employers and national economies are escalating, and everyday low-income families are being driven into poverty by loss of earnings due to diabetes and the lifelong costs of healthcare. Already 366 million people have diabetes and another 280 million are at identifiably high risk of developing diabetes. If nothing is done, by 2030, this number is expected to rise to 552 million with diabetes and an additional 398 million people at high risk. 3 out of 4 people with diabetes now live in low and middle income countries. Over the next 20 years, Africa, Middle East, and Southeast Asia regions will shoulder the greatest increase in diabetes prevalence. Even in rich countries, disadvantaged groups such as indigenous people and ethnic minorities, recent migrants, and slum dwellers suffer higher rates of diabetes and its complications. No country, rich or poor, is immune to this epidemic. Recognizing the challenge and impact on human development, the International Diabetes Federation brought together world experts to develop the first ever global diabetes plan to galvanize and inform actions on diabetes over the next decade. The plan sets out the evidence, cost-effective solutions and tools in a coherent framework for action and represents the consensus of the global diabetes community. The Global Diabetes Plan was launched in 2011, a milestone year when world leaders met at United Nations headquarters in New York to agree actions on diabetes and other non-communicable diseases. I am proud that International Diabetes Federation was among the first to call for a UN high-level summit on NCDs, but that meeting was just the start. We will continue to work with our partners to turn political promises into global action for people who have diabetes now and to reduce the rate of the future development of diabetes and its insidious complications. We have the evidence. Now, with the Global Diabetes Plan in our hands, we are one step closer to stopping avoidable deaths and reducing the sufferings caused by diabetes. Thank you.